started your timer and here is your question. Right, so if you have read and understood, considering it communication skills station, kindly begin.
Okay. Hello, good morning. I'm Dr. Mo, one of the surgical doctors here. So I've been told that you want to see one of the doctors here. So before that, can I confirm your name and age, please?
Yes, my name is Braun and I am 48 years old.
Hi, Ron. Nice to meet you here today. So how can I help you?
I want to leave this hospital because it is very disappointing and frustrating to live in the hospital for a longer period.
Oh.
And I'm feeling well. I do not want to live here.
I completely understand that you are having a difficult time staying at the hospital. But Ron, can I confirm, can I check, what do you know so far about your condition?
Yes, I have, as you know that I have an accident, road traffic accident, and I have an injury in my left side of the chest and abdomen. And there may be some fracture of the ribs and there is some organ damage, but doctors say that I am well and I'm also feeling very well. And so I decided to go to home.
Right, you're correct. You have got an injury, a rib fracture from the injury you sustained. And from that injury, and there was an organ behind the beneath the rib is also damaged a bit, but apparently it is bleeding just a bit. So this is why you are kept at the under observation. So because at the moment you are quite stable, the vital signs are good, your breathing, your heart, everything is quite under control. But from the investigation, what we found is your hemoglobin is, the blood level is, it has dropped a little bit from 12 to 10, which means that there will be a likely bleeding inside your around your organ. So this is why you are kept in the hospital, Ron. Are you with me so far?
There is another problem in my home that my wife has cancer and I have an appointment for her to the doctor. So it is necessary to go to home for this task.
Oh, I completely understand that you're having a problem with your some kind of problems with your dealing with your wife, sending her to appointment. So by the way, can I say what the appointment time will be? Is that today or tomorrow?
It is in the evening today.
Oh, that's pretty good. But Ron, from the medical point of view, you are not. You shouldn't be going back to your home at this point. What about trying sending the social services to your home, and who can pick up your wife and send her to the appointment? Would that be okay for you and her?
It may be possible, but I have many problems. That I have also a job interview, and I have to visit another city tomorrow. And for this purpose, I want to go to my home to prepare my documents, and I want to go.
That sounds, well, that sounds really important to you. But anyway, Ron, if there is a bleeding inside and if it continues, you might encounter a lot of problems before you reach to the job interview when you are preparing your paperwork at home. So how about arranging a virtual interviews for the job interview? We can contact the company and like make a request to them to arrange a virtual interview for you. How about that?
No, madam, this job is related to business and it is not the virtual type of interview. And I have to communicate and I have to give some documents and dealing. And this must be possible with my physical presence. So I'm very sorry to live in the hospital.
Well, so in that case, what I recommend is from the medical point, please don't go back to your home. And I understand that your work is also important, but here in this condition, your health is more important than your job right now. And now, if also about your wife, if something bad happened to you, there will be nobody taking care of her. So this is why I'm telling you to keep staying at the hospital. And one thing is, we only keep the patients who are necessary to be kept under the medical care. Well, Ron, how about, are you with me so far?
Yes, but I am not agree, madam. And I want to go and please arrange some conveyance or taxi for me so I can go to my home.
Okay, well, Ron, so there is only one thing we can do right now, which is called the discharge against medical advice, which means that you fully understand your current condition. You want to discharge against our advice, and you fully understand what kind of complications you can encounter, including bleeding, infection, and even the worst case scenario, you may endanger your life. You will take care of you will take the full responsibility of all the adverse outcomes. So if it is how it works, so you have to sign a legal documentation stating that you understand and take care of, you take all the responsibilities. So after that, you will be able to get discharged from the hospital. Are you happy with that?
Yes, okay, madam. I will sign it.
Okay, so but before that, what I would like to tell you some warning signs for you. If you start to feel dizzy or start to feel like very weak, or like you are not you are having like you're feeling your heart is beating so fast, please seek medical attention at the nearest hospital as quickly as you can. So because there might be some complications inside, such as bleeding. So this is what I would like you to advise.
Okay,
how does it sound?
You,
okay.
Yes.
So right. Okay. So let me summarize this up before you get discharged, so you understand what I have explained everything to you. Why you shouldn't get discharged from the hospital. You understand all the complications such as bleeding, infection, and then you sign the discharge against medical advice form before the discharge. All right.
I will summarize. I will summarize, or you will summarize, madam?
I will summarize.
Yes. Okay. Yes, yeah. I understand, madam. I understand.
Okay. So
I agree with the consequences.
Yeah, we are always here to support and assist you. So
yes.
Is there any other questions?
Yes. Are you arranging some taxi for me?
Yeah, there will be the ward coordinator who will be arranging a taxi for you. Okay. All right.
Thank you. Thank you.
Okay. If there is any further question, just feel free to ask me. I will leave my phone number with the nurse.
Okay. If patient is leaving hospital against medical advice, then you are not supposed to help or arrange anything for the patient. then it's patient's own headache to go home.
Okay.
So that was wrong. And then when you were explaining everything, especially when you told the red flags, the sign and symptoms that patient has to watch out for, then you should have asked the patient to summarize it or tell you whatever you have told the patient, so that you can check the competence of the patient, if patient is competent enough to make the decision to go home. So that you have missed. And then one or twice you have used medical terms like vitals are stable. Patient would not understand what vitals are, and nor a legal document. You can, even if you mention Dama, patient would not understand what that is. But then you can say, okay, then there is this form that you have to sign it, and make the patient sign that form. And you know what that form is. Just that. What else? Right. Thank you.